Hi everyone, let me recall some of the questions from today's MRB exam. There is a question on communication scenario. The answer is semantic barrier. The accurate measurement of gestational age can be done by crown rump length. Technosphere insulin is Afresa. The infectious plastic waste, it should be disposed in red bin. Nifopam is a non-opioid centrally acting analgesic. Rest of the options act through prostaglandin inhibition. Clozapine has the least extrapyramidal side effect when compared to other second generation atypical antipsychotics. There is a question on histoplasmosis. The answer is granulomatous reaction. There is a question on all or type 3 hypersensitivity reactions except, that is, Goodpasture syndrome is a type 2 hypersensitivity reaction. HIV in the first line preferred regimen is TLD, that is tenofovir, lamivudine and dolutegravir. Delirium, frailty is not a risk factor for delirium. Other options like previous history of delirium, sepsis, metabolic disturbances, all these will cause delirium. There is a question on dementia. The answer is minimal cognitive impairment because the MMSE score is 26. To say it as dementia, the MMSE score should be less than 24. So, vaccine which is not contraindicated in pregnancy, anti-rabies vaccine. Vaccine which is stored in freezer without any damage, MMR or Rota vaccine. Vaccine additive for increasing immunity, adjuvant. Posterior portion of femoral sheath is formed by iliac fascia. Torus fracture, it is an incomplete bone fracture that occurs when a bone is suddenly compressed, usually from a fall of outstretched hand. It is most common in the distal part. Dashboard injury, posterior hip dislocation. CRP elevation is seen in necrotizing bacterial infection. Lymphocytes are the white blood cells that can continually move between blood and tissue. They do this by recirculating through the central lymph. Glue transporter, question, the type 6 is located in brain. Renal nerve, this is least splanchnic nerve. Pulseless disease is Takayasu arteritis. There is a question on T cell infiltration and granuloma, all except serum sickness. Wolff-Parkinson-White syndrome, ECG findings are given. The answer is initial slurring of QRS, otherwise called delta wave. Purkinje fibers has the fastest conduction among the conduction system. Thebesian valve, it is medial to the inferior vena cava opening. The cystic ducts valve, that is spiral valve, which is also called a valve of Easter. And there is a question on liver versus gallbladder bile. Hepatic bile is alkaline and the gallbladder bile is slightly acidic. Hurthle cell is seen in Hashimoto's thyroiditis. Rill's lobe is seen in liver. Aldosterone, the main function is sodium reabsorption. Adrenaline dose in infiltrative anesthesia, 1 in 1 lakh to 1 in 60,000. I am not sure about the exact answer. And intraoperative changes in anesthesia, general anesthesia. There is an option requires a lower insulin dose, but on contrary, in intraoperatively you have a cortisol surge which will increase your sugar levels, so you need a higher insulin dose. Dominance of coronary artery is decided by posterior descending artery. Histogram, if connected, will get a frequency polygon. Hidden hunger is a term used to describe a lack of essential vitamins and minerals or micronutrients in the body. Dinoprostrone gel, this is to prepare for your cervix for labor and delivery. GnRH superagonist except cetrorelix. The other options are all GnRH superagonists like gusarelin, bosarelin. Wilson disease, the answer is sunflower cataract. Fleischer ring is seen in keratoconus, not disease. In Wilson disease, we see KF ring. Most common malignant tumor of parotid gland is mucoepidermoid carcinoma. Lomifloxacin is the second generation fluoroquinolone. Others like ciproflox, norflox, pfloxacin, all are first generation. There is a question on all are natural prostaglandin except misoprostol, which is a synthetic prostaglandin. The left hilum is usually higher than the right hilum, typically by 1 to 2 centimeters. And there is a question, a boy with medullary infection, recurrent medullary infection, done grommet insertion. After eating ice cream, he had some soft taste sensation. And the nerve involved is cauda tympani nerve. Hepcidin is the iron regulator. And there is a question on lead poisoning, all or except Measles is seen in arsenic poisoning. Speedballs, it is a combination of cocaine plus heroin. Anti-CD20 antibodies, rituximab. Acute schizophrenia, the answer is delusional paranoia. Rest of the answers are for depression. OPC poisoning, the scenario after 3 days the patient is presenting with the proximal muscle weakness and respiratory failure. This is intermediate syndrome. In India, the birth registration should be done within 21 days. Hypoventilation, this is because of diaphragmatic muscle paralysis, neuromuscular disease. Acute hypernatremia correction, mostly this will cause arrhythmias. Acute hyponatremia correction will cause central pontine myelinolysis. To announce an area as rabies free, that area should be free of rabies for at least 3 years. Prerenal AKI seen in sepsis. Gadolinium contrast use will cause nephrogenic systemic fibrosis. Fetal well-being question, all the above is the answer. Risk factor for hospital acute pneumonia, all the above is the answer. Chickenpox incubation time 10 to 21 days. Vesicovaginal fistula, the question is most common cause of vaginal fistula. I think it is abdominal hysterectomy. High risk polio affected area, it has to be covered with pulse polio vaccination. Endometriosis USG, low internal echoes. There is a question on biomedical waste management. Infectious plastic waste should be disposed in red color bin. Coronary still phenomenon is caused by dipyridamole. Junctional scrotum of tracheor, it is because of the damage to the optic nerve and optic chiasm, that is proximal part of the optic nerve. Vidian neurectomy is done for vasomotor rhinitis. Most common shock and trauma is hypovolemic shock. The ideal time to get the pneumococcal vaccine is at least 2 weeks before an elective splenectomy or as soon as possible after the splenectomy. Number of oocytes at puberty is about 3 lakhs. Candle wax deposits is seen in sarcoidosis. Partially cooked meat, the most common organism is Staphylococcus aureus. Type of Streptococcus infection common in infancy and pregnancy is type A. Epley's maneuver is done for benign paroxysmal positional vertigo. Loss of 3p mutation is frequently observed in squamous cell carcinoma of lung. The flexor carpi radialis muscle is innervated by median nerve, not radial nerve. Ashas make 5 incentive home visits to children between the age of 3 to 15 months. Not a systemic autoimmune disease. Pernicious anemia. Pernicious anemia is also an autoimmune disease. It will cause hematological and neurological manifestations. The chromosomal translocation T1418 is the genetic hallmark of follicular lymphoma. Technosphere insulin is Afresa. TRS, that is thyrotropin releasing hormone, is a tripeptide. Please type the other questions in the comment section if you remember. If you like the video, subscribe the video and share to your friends. Thank you.